we're very happy to go again from this topic of artificial intelligence, machine learning, and data science to from one of the leaders in the ecosystem, Tim Gilchrist from Anthem, to a company who's leading the storm when it comes to putting this machine learning, and like you just saw some great examples of Python. These folks are actually putting the Python into action in their product, and AccurKardia, a technology that we are studying currently at HITLAB. And I want to introduce the co-founders and the CEO, Juan Jimenez, and the CTO, CPO, Sadeq Ali. And again, Juan and Sadeq, thank you for joining today.
Thank you, Stan, and thank you for the opportunity.
No,
Thanks
it's great
for having
to,
us.
No, it's really appreciated. And let's dive into it. Tell us a little bit about yourselves and AccurKardia, and Juan, why don't you lead off?
Sure. As you mentioned, Stan, I'm Juan Jimenez, co-founder and CEO of AccurKardia. In AccurKardia, we are in the business of saving lives using ECG data to perform automated analysis in a device agnostic manner. What I say device agnostic is that we are harnessing data coming from clinical, inpatient, outpatient ECG devices to consumer wearables and IoT devices. So we are bridging that gap in analysis of the vast number of data available out there.
Fantastic. And Sadeq, a little bit of your background as well, just individually your journey.
Yeah, I have been in tech for really all my career. Started off at Accenture a number of years ago, met Juan while at Columbia Business School in the late 2000s. Been an entrepreneur since 2010, and more or less stumbled upon AccurKardia and the scientists working on it back in 2018 while in Bangalore, and was able to convince Juan and a few others that this was interesting enough for us to take a look at and basically build a company out of. So been working on AccurKardia, I guess, now for close to 5 years.
It's fantastic. And again, love that you guys are Columbia Business School products and legacies. So, let's talk a little bit about that, Sadeq, for a second. Jump into how you're using AI in your product. I think our audience today is keenly wanting to understand that, if you could.
Yeah, so, I mean, just in terms of us in particular, we decided to use AI more as a scalpel than a hammer. So we use it very, very surgically. And we do that for various reasons. But effectively, our product combines, a lot of traditional computer algorithms, including signal processing related algorithms, including image analysis related algorithms that are not ML and AI driven, to do a lot of the initial sort of processing of what's needed. We leverage AI on top of that to improve our accuracy and to do things that without AI, we only get to a certain degree of say, positive predictive value, and we want to increase that to, say, close to 100%. We use AI for that. But essentially, we use AI in a much more intelligent way, I think, at some level in this space than simply taking a lot of data, building a very large neural network off it, and then using that to then diagnose arrhythmias. We're doing something a little bit more sophisticated than that, I would think.
Okay, that's fantastic. And that really dives into a little bit more. Now, for our audience's sake, now you know why the Columbia MBA is the highest earning starting salary of any MBA in the world. People like Sadeq and Juan are coming out, and they can explain things like that to folks. And obviously that changes healthcare, revolutionizes healthcare for sure. And so, Juan, maybe you could dive into it a little bit more as well and talk about, to our audience here, again, a lot of laypersons and whatnot, but talk about what some of the challenges for AI in healthcare that you've encumbered while starting and growing AccurKardia.
Sure. I think one of the biggest challenges in AI in general in healthcare is explainability. If as a scientist or data scientist, AI researcher, or let's say entrepreneur, you cannot explain to the user, which are clinicians, doctors, scientists as well, the output that you're producing using your AI models. It's very difficult to go to market or any adoption process. So for I think in general, explainability of using AI is at top of the importance. So, and we have used that approach in the way we use AI in our products to making sure clinicians, doctors have explainable answers from the output coming from our product. That's one. And second is validation. Doesn't matter how good the models are, if you don't spend enough time, efforts, resources on validation, it is as important as the innovation within the AI models. So that's a lesson that we have learned as entrepreneurs, and that's why we have partnered with HITLAB for our first clinical study using the Apple Watch and our AI models. But I think in general, it is very important to dedicate resources early on validation, using robust data sets, diversity within those data sets, and as important as explainability. So I think it's if having products in mind that are explainable and have solid validation, I think it's going to ease the adoption process.
That's great, and we'll get back to you in a minute, Sadeq. But before we jump over there, Juan, just a question came in through LinkedIn from one of the audience members. They want to know, what was your passion for starting the company? Where did it come from, and how has it driven you?
Sure. I think AccurKardia in general for me was that I didn't believe that in the 21st century, in 2018, 2019, still people were counting heartbeats using calipers. Now those calipers are digital calipers, but still it doesn't make any sense in this day and age spending clinicians' time, cardiologists, nurses, physician assistant, counting heartbeats out of a digital ECG, and for me, having to bring change into the world, and by improving patients' outcome, and also helping alleviate the overwork of clinicians, that's what made me leave my comfortable job managing a 700 people company and start a new company with Sadeq and other great smart folks from Columbia Business School, and also other great universities as well.
I love it. And that's really interesting, just for the audience's sake. And again, having been at Columbia myself since '96, and now a big part of the Columbia Business School digital health program, one of the things that really does set the Columbia Business School alumni apart is that compassionate capitalism. That's just so nice to see, where you see folks like these two gentlemen coming out of there and really using their finely honed management, technical, and financial skills to bring about change in healthcare in a just a brilliant way. And we'll wind up, Sadeq, since you're the CTO and really the CPO of AccurKardia. When you look at AI and machine learning and some of the new stuff that we're reading about every day with ChatGPT and BERT, as Tim's now talked about from Anthem, what do you see as the future of these technologies in healthcare, and how they can be deployed and implemented in a rational way that'll make healthcare better and make physicians and nurses and clinicians and their jobs easier?
Yeah, so if you sort of think about what drives improvements in AI, it's essentially three things. It's one, improvement in the algorithmic efficiency, so having better algorithms. The second is access to data and having larger and better data sets, more labeled data sets, ideally in the case of healthcare, available to you. And then the third is compute, having more compute, as well as more efficient compute available to you. So the things like GPUs are a lot more common now than even half a decade ago. We are seeing an explosion in potentially additional compute capacity coming online over the next decade. Quantum is starting to make some noise as well. So all of these things are starting to come together that make sort of the future for AI very interesting. But I think, kind of going back to what Juan said, particularly in the healthcare space, even with all of these things, we have to make AI transparent and explainable. If we just have pure black box algorithms doing diagnosis without the ability for a clinician to then be able to take that diagnosis and be able to rationalize it and handle that last mile, just becomes extremely difficult. So particularly from a healthcare perspective, I think the ability to do that in a way that ultimately makes it relevant in the context of a clinical workflow is extremely important. And I think the other side of it is also that AI has to start moving more towards the edge as well. So far, all of the AI that we've largely seen runs on cloud computing capacity. But if you start looking at use cases, both within healthcare, but also outside of healthcare, where AI particularly for any data originating from the body, needs to potentially be used. Having the ability to run at the edge on low compute footprints, that is going to be extremely critical as well. So I think those two things have to be thought about as we think about AI in healthcare, as well as using healthcare data in other contexts.
Brilliant. All right. I love it. Love to see it. Love to see the Columbia MBA in action, the alumni force coming into healthcare. So welcome again. Thank you both, and appreciate your time today, and looking forward to seeing and hearing great things from AccurKardia. Thank you, guys.
Thank you, Stan.
Thank you.